Hello, everyone. This is Dr. David Pascal talking to you from the Pascal Health Institute in gorgeous Cary, North Carolina. We are having an amazing start to our year here in February of 2026. And I want to talk to you today about the connection between autoimmune disease and CRPS. Why and what is the connection between complex regional pain syndrome and our immune system, particularly autoimmune disease. So first of all, let's define autoimmune disease. We all have an immune system. The purpose of that immune system is to keep us healthy, right? To repair any damage that we have, to protect us from any foreign invaders like viruses, bacteria, molds, toxins, environmental chemicals, and whatnot. But for some people, they have a genetic issue where their own immune system flips a switch and begins attacking itself. And there are many different autoimmune diseases, but the major ones that most people think of are rheumatoid arthritis, where our immune system looks at our own joints, right, particularly in our hands and neck, and says that's the enemy, and actually goes and attacks the joint and eats the joint just like a termite would eat wood. Just like our immune system would send white blood cells to gobble up a bacteria, right? So that is rheumatoid arthritis. We have multiple sclerosis, where our own immune system is attacking the nerves of our body, creating primarily scarring of the nerves so that they no longer function, and we decline that way. We have celiac disease, where the immune system is attacking our small intestine. How crazy is that? 70% of our immune system is in our small intestine, and celiac is attacking that. We have type 1 diabetes, where the immune system is attacking the pancreas, particularly the cells of the pancreas that are creating insulin. So then we lose the ability to make our own insulin. So then we have to do injections to cover that. We have some other GI issues like Crohn's disease, where we have this inflammation in the large intestine. And we also have ulcerative colitis, where the immune system is creating these ulcers in the lining, the walls of our colon. I made a little list to make sure I wouldn't forget anything. We have systemic lupus erythematosus, where we again have a big inflammatory condition. We have psoriasis and eczema, where the skin is being attacked, and it primarily manifests with all sorts of lesions on the skin. And I think that those are the major ones that I wanted to cover that many people have when they have autoimmune disease. So why is this happening? If you've heard me in the past talking about complex regional pain syndrome, you know that for me, there are really two types of CRPS. There's the type that I label the neurologic. This is the peripheral nerve disease, where our nervous system is kind of divided into two parts. There's the central nervous system, which is our brain stem, and our spinal cord. And then there's the peripheral nervous system, which are the nerves outside of the spinal cord that are going to our skin and our muscles and our organs and all of that. About 20 to 30% of the people with CRPS, that's their problem. It's the peripheral nerves that are firing like crazy, primarily the pain nerves, and then we have this off the chart pain. This type of CRPS can respond to pain medications. It can respond to procedures that are blocking the peripheral nerve, like a nerve block or a nerve ablation, where they basically fry the nerve, the pain nerve, or even like a spinal cord stimulator, where they're trying to block those signals going up to the brain. 20-30% of the people with CRPS will get relief with that. The other 70 or 80% of the people with complex regional pain syndrome, it doesn't matter how many drugs they take, it doesn't matter how many medical procedures they do, they still have pain. And these are the people that are the complex uh, regional pain syndrome. So they have multiple causes. We've talked about this before, where they have a hormone imbalance. They tend to be highly sensitive people. They do have a nerve problem, but it's brain generated nerve condition. And then we have this big autoimmune factor. Most clinics that are addressing CRPS, they may be addressing the peripheral nerves, they may be addressing the central nervous system, and they may be addressing hormones, although that is fairly rare. But what I almost never see is other programs besides my own that are out there addressing the autoimmune component of CRPS. So, this is something, autoimmune disease, that most people have. It could be dormant before the trauma that created the CRPS, or they could have already had it to some greater or lesser extent. But all the people that are in this complex CRPS category, all of them that I have seen have at least one autoimmune issue. And that's how you heal, right? It's your own immune system that allows repair. And if that is in dysfunction, how are you going to repair? You're not going to repair. And that's why people with CRPS are not getting better. That's a major reason why. So you need to, I have found from clinical experience, you need to have a specific part of your care directed toward the repairing of your immune system and the restoration of normal immunologic function. This is completely independent from normalizing hormones, from minimizing the highly sensitive component of CRPS, from addressing those factors that are causing the brain to generate these high levels of pain. If you don't repair the body's ability to repair, then all those other things are going to be for naught. So in my office, the foundational part of my care, and what really allows us to have such a high success rate with the CRPS patients that come to see us, is that we are restoring normal immunologic function. I've developed a technique where for most people, we can put their autoimmune disease into remission. And even the ones where we can't put it into remission, we have been able to greatly reduce their symptoms 70-80%. And this allows their body to heal much better. Not at 100% if they still have active autoimmune disease, but at a much, much higher level. So the slowest that we're doing is we're boosting that immune system up 50-60%. And the best that we're doing is we are putting that autoimmune disease completely into remission and bringing that body's ability to heal as high as we can get it. So if you do have CRPS and you tried a bunch of different treatments and you are not progressing, then maybe it is this underlying component of your body's inability to heal due to autoimmune disease. So if you would like to talk to me about that, you can reach out, call us, email us, reach out on our website. We're very easy to get a hold of. My phone number is 919-380-8000. Our email address is drpascalhelps@gmail.com. My website is www.drpascal, drpascal.com. And we are pretty easy to get in touch with. My office manager is fantastic at answering almost any question, but if you'd like to set up a Zoom call with me, we do that at no charge. Do a 20-minute Zoom call. Be glad to talk to you about all the different parts of your CRPS, but if you want to talk specifically about the autoimmune component, then I would love to do that with you. Also, I do have a YouTube channel, Dr. Dave Pascal, on YouTube, so you can go there. We have lots of videos where I talk about all the different component parts of CRPS and how I address them. So I hope you have found this little video helpful. Please reach out to me if you would like my help. Also, if you know other people that do have CRPS, please let them know about what we are doing here, how they look at my stuff, because we're just trying to help as many people as we can with this horrendous neurologic disease. All right, so from now, we'll call it an end. And you can also comment on this below, and we can respond to any comments that are left in the video below. Okay, have a best February that you can, and I will look forward to talking to you all again in 2 weeks. We do this every other Tuesday at 2. Take care, everyone.